1. A patient arrives at the emergency department complaining of mid-sternal chest pain. Which of the following nursing actions should take priority? A complete history with emphasis on preceding events. B. An electrocardiogram. C. Careful assessment of vital signs. D. Chest exam with auscultation 1. Answer: C. The priority nursing action for a patient arriving at the ED in distress is always assessment of vital signs. This indicates the extent of physical compromise and provides a baseline by which to plan further assessment and treatment. A thorough medical history, including onset of symptoms, will be necessary, and it is likely that an electrocardiogram will be performed as well, but these are not the first priority. Similarly, chest exam with auscultation may offer useful information after vital signs are assessed. 2. A patient has been hospitalized with pneumonia and is about to be discharged. A nurse provides discharge instructions to a patient and his family. Which misunderstanding by the family indicates the need for more detailed information? A. The patient may resume normal home activities as tolerated but should avoid physical exertion and get adequate rest. B. The patient should resume a normal diet with emphasis on nutritious, healthy foods. C. The patient may discontinue the prescribed course of oral antibiotics once the symptoms have completely resolved. D. The patient should continue use of the incentive spirometer to keep airways open and free of secretions too. Answer: C. It is always critical that patients being discharged from the hospital take prescribed medications as instructed. In the case of antibiotics, a full course must be completed even after symptoms have resolved to prevent incomplete eradication of the organism and recurrence of infection. The patient should resume normal activities as tolerated, as well as a nutritious diet. Continued use of the incentive spirometer after discharge will speed recovery and improve lung function. 3. A nurse is caring for an elderly Somali patient in the terminal stages of lung cancer. Many family members are in the room or around the clock performing unusual rituals and bringing ethnic foods. Which of the following actions should the nurse take? A. Restrict visiting hours and ask the family to limit visitors to 2 at a time. B. Notify visitors with a sign on the door that the patient is limited to clear fluids only with no solid food allowed. C. If possible, keep the other bed in the room unassigned to provide privacy and comfort to the family. D. Contact the physician to report the unusual rituals and activities. 3. Answer: C. When a family member is dying, it is most helpful for nursing staff to provide a culturally sensitive environment to the degree possible within the hospital routine. In the Somali culture, it is important that the dying be surrounded by loved ones and not left alone. Traditional rituals and foods are thought to ease the transition to the next life. When possible, allowing the family privacy for this traditional behavior is best for them and the patient. Answers A, B, and D are incorrect because they create unnecessary conflict with the patient and family. Thanks for watching. Please subscribe. More nursing tips.